Hello, this is Dr. Anna Maria Michalczak. I'm the president of AM Medical LLC in Yale, Washington. Today I'm going to talk about atherosclerosis, considerations of causes, prevention, and reversal. The information that I'm going to refer to in this talk is based on some extraordinary scientists. Linus Pauling has won 2 Nobel Prizes. He made significant progress and contributions to medical science with orthomolecular medicine, discussing how nutrients and vitamins can be utilized in high doses as medicine. Dr. Thomas Levi is an author, physician, and attorney. He wrote several books, one of which is Stop America's #1 Killer. He talks about the effects of vitamin C deficiency on the development of atherosclerosis. Much of what I'm going to talk about in regards to vitamin C is taken from this book. I highly recommend everybody to read it. I also recommend his other book called Panacea of Healing, which talks about vitamin C in a broader term for other diseases. Elmer Cranton wrote Bypassing the Bypass Surgery. It's a historical account of the science of chelation therapy. Broda Barnes, he was a physician endocrinologist, actually physician for medicine in Chicago in the 1940s, 50s, and he wrote The Riddle of Heart Attacks Solved. This is regarding thyroid replacement, bioidentical thyroid replacement with desiccated thyroid hormone. Some of the information that's presented here is very much different than what is presented in the mainstream. The idea that high cholesterol is really the cause for atherosclerosis. Well, it's not quite that way, and there are things that should be taken into consideration. Atherosclerosis causes oxidative stress in the arterial wall has been shown to be starting the process of inflammation, and it's been shown in multiple studies that in the vascular wall there are low levels or depleted levels of the antioxidant system like glutathione, and that the initial steps are also related to vitamin C deficiency, because vitamin C is responsible for proper collagen matrix building, and scurvy or vitamin C deficiency in extreme forms can cause problems in many ways, which we will discuss. Heavy metal body burden that is increased through lead, cadmium, arsenic. These heavy metals have interactive effects, and they are affecting the antioxidant system and are depleting it and causing other problems. Mechanical turbulence is a risk factor for atherosclerosis, so the arteries like carotid, the coronary arteries that are in places where there are bifurcations, meaning crossing pathways. For example, when there's a lot of turbulence from high blood pressure, it causes this mechanical stress on the vessel wall. Nitric oxide deficiency has been shown to be a factor in the progression of atherosclerosis. The overall synthesis of nitric oxide gets downregulated by a number of causes, for example, high heavy metal burdens in the body after age 40. We will see that statin use can be causing problems, and very high cholesterol, if the above conditions are present, can contribute to atherosclerosis. There's a Professor Hartenbach, he was a university professor in Munich, who described the cholesterol lie, which is the fairy tale of bad cholesterol. So he examined thousands of artery plaques, and he found that cholesterol is not the causative factor of atherosclerosis, but that there are pathological changes in these artery tissues that are observed way before the fatty streaks in the artery walls are observed. So there's something that happens before the cholesterol gets deposited. The cholesterol itself is not the causing mechanism. What's interesting here, there's a Dr. Okuyama in Japan has written extensively about concerns that statins actually stimulate atherosclerosis and heart failure and how that works. So he described that the mitochondrial toxins that a statin is, it impairs mitochondrial function. Mitochondria is the powerhouse of the cell. And in the heart muscle, for example, there is about 5,000 mitochondria per cell. So when we have a substance like a statin that inhibits mitochondrial functioning, that can impair muscle function in the heart and in the blood vessels. Everybody knows that statins deplete CoQ10 and another substance called heme A, and that those are involved in the energy generation of the cell. So without these coenzymes, the production of the ATP, which makes the energy in the heart muscle cells, is impaired, and the lower the energy production, the lower the functioning of the cell is. Statins also inhibit the manufacturing of vitamin K2, and that is part of being helpful for this matrix protein activation, which is something that protects the arteries from calcification. So everybody has heard that you have to take vitamin K with your vitamin D because you don't want the vitamin D, that's a transport molecule for calcium, to deposit the calcium into the artery wall, and that the vitamin K has protective action. Statin also inhibits the biosynthesis of proteins that contain selenium, and part of that is glutathione. Glutathione is one of the most important antioxidant and toxin binding substances in our body. And so when you no longer have the ability to address what's called oxidative stress and free radicals, which is a process by which the cells are aging, then the aging process is extremely accelerated. So it appears that that is part of the cause for things like congestive heart failure. So Dr. Okuyama had raised many concerns regarding the widespread use of statins. And people say red yeast rice is better, but red yeast rice is lovastatin. The monocolin K is exactly identical to lovastatin, so that is also a mitochondrial toxin. The following information is taken from Dr. Levi's book, and really it explains in a fantastically concise way, very well documented, the relationship between cholesterol, vitamin C deficiency, and atherosclerosis. And what's been shown is that cholesterol only adds to the development of arteriosclerosis after this process has been initiated by degenerative changes in the artery wall because of vitamin C deficiency. Vitamin C neutralizes toxins and including heavy metals. It is a chelator. When you don't have the vitamin C, these toxins cause an increase of cholesterol because cholesterol is a molecule that neutralizes toxins. So in 1978, studies have found that vitamin C deficiency alone would result in arteriosclerosis that's accelerated, and that the cholesterol and the triglycerides would be deposited into the aorta, into the blood vessel wall, without even having cholesterol in the diet. We naturally produce cholesterol in the body, as do animals. So even if you have an extremely low-fat diet, it appears that it's the vitamin C deficiency that contributes to the cholesterol being deposited. Then in 1953, a study showed that when guinea pigs were fed high cholesterol diets, and then they were given vitamin C, that the arteriosclerosis was prevented. And the reason why that is that these arteries have a basement membrane that is a gel-like. They're now calling it the endocalyx or glycocalyx. And vitamin C is involved in keeping that gel in the proper state. But when vitamin C is deficient, then the collagen in that gel cannot bind and it becomes watery and thereby vulnerable. So the next thing that's been shown is that when vitamin C in the arterial wall was depleted, and those were areas of high mechanical stress, for example, the carotid arteries, the coronary arteries, where there's a lot of flow, turbulence, that would then cause injury in the blood vessel wall. So the next step is that vitamin C causes wound healing difficulties. Everybody knows that. Scurvy in the sailors causes bleeding gums and structural abnormalities of the collagen, wound healing difficulties. It is said that when a blood vessel is scarred or injured, it requires even more vitamin C to repair itself and to maintain its integrity. Now, the deposition of the plaque, which is made of cholesterol, is a mechanism to compensate for that weak wall because of vitamin C deficiency. There's a scarring, a thickening of the artery wall, and then there's leakage of blood into that plaque that then leads to further plaque progression and growth. And high blood pressure can initiate and then promote this continuous plaque buildup because it's overtaxing the collagen depleted blood vessel, so it causes more injury. So there's injury upon injury, and this is how arteriosclerosis progresses. Vitamin C deficiency has been linked to high blood pressure. It's been shown that a combined antioxidant supplementation that also included vitamin C reduced high blood pressure. There was a placebo-controlled double-blind study in 1999 that showed that vitamin C was effective as a single therapy, no other blood pressure pills, in lowering blood pressure of patients who had high blood pressure. And there were multiple studies that have shown that there's a correlation between higher levels of vitamin C in the blood and lower blood pressure. The issue with vitamin C, I have said that in previous videos, is that humans have a genetic defect. We can not make out of the molecule glucose ascorbic acid. And because of that, we have to take it in every day. Our diets are chronically nutritiously depleted, and so we are not able to get enough vitamin C to be able to sustain high enough levels. What has been shown in regards to arteriosclerosis, that cholesterol were taken up into the artery wall when the cholesterol is extremely high, so over 250 total cholesterol. But then when the cholesterol levels were lowered, that the cholesterol initially was reabsorbed, meaning that process is reversible. Vitamin C slows down the penetration of cholesterol to go into the blood vessels, and it increases the release of the cholesterol that's already in the blood vessel wall. So vitamin C is effective in slowing down the progression of arteriosclerosis, as well as promoting the reversal of arteriosclerosis. Lifestyle changes, exercise, nutrition, stress reduction, all of these things that are increasing inflammation are all preventative strategies. There are several studies that have shown that patients who take vitamin C on a daily basis can lower their total cholesterol numbers. In 1970, a study showed by an average of 34 points in diabetic patients with not a very high dose. 1,000 milligrams of vitamin C is not very high. If you think about that, in a healthy patient, between 20 and 40% of oral intake is absorbed. So what you're actually getting in your blood is a low level. Over 1 year, they were given 1,000 milligrams of vitamin C, and the cholesterol dropped from 40 up to 100 points. This is because what is affected here is that vitamin C increases an enzyme. It's called the lipoprotein lipase, and that is clearing arteriosclerosis out. Another study showed that in 50 out of 60 patients with high cholesterol level and heart disease, when they were given between 2,000 and 3,000 milligrams of vitamin C, they increased that enzyme that clears arteriosclerosis out of the blood vessel wall by 100%, and the vitamin C lowered triglycerides by 50 to 70%. There are studies that show that cholesterol serves as a neutralizer and an activator of toxic substances. And there are more accounts in Dr. Levi's book, Panacea of Healing. I strongly recommend reading that. It shows that elevated cholesterol seems to be a marker of toxic exposure. For example, total heavy metal burden, increased pesticides, can increase cholesterol levels. Once you eliminate the toxic exposure, for example, you get the mercury amalgams taken out, you get the root canals reversed, you get heavy metals chelated, the cholesterol levels will drop. Vitamin C can lower cholesterol because vitamin C is a toxin neutralizer, so you don't need to make as much cholesterol to help the body. It has been shown in multiple studies that patients who have abnormally low cholesterol have an increase in all-cause mortality, meaning they die sooner, and they have a greater incidence of cancer and death from cancer. Inflammation is a major cause of arteriosclerosis, as well as the progression, and then the destabilization of the arteriosclerotic plaque, which then, once a piece of that plaque breaks off, it downstream causes an infarction, for example, a heart attack. And it's been shown that the plaques that break off and cause these complications have a large amount of inflammatory cells, and that the stable plaques, which don't break off, have lesser complications, less heart attacks, and less inflammation. Inflammation is a protective reaction of the body, and it is trying to lessen the injury to that artery wall. White blood cells, as you know, the immune system of which the white blood cells are part of, they need vitamin C to function. So vitamin C deficiency causes immune dysfunction. White blood cells have up to between 25 to 80 times higher levels of vitamin C than in the surrounding blood plasma. The artery walls are depleted in vitamin C, so it appears that the white blood cells are going to the artery wall to deposit its vitamin C because the artery wall is suffering, and it is attempting to keep the local levels of vitamin C from getting even lower. In 2001, a study found that patients with severe arteriosclerosis, this was in the legs, had chronic inflammation and low vitamin C levels in the blood. It appeared that the low vitamin C levels were directly related to the presence of inflammation and the severity of vascular disease. Hence the idea that vitamin C increases, that downregulates inflammation and helps vascular disease. The toxins in our body can use up the vitamin C in the blood. So for example, vitamin C neutralizes heavy metals. When there are high body burdens of heavy metals, you use up vitamin C stores faster. It's also been shown that sicker patients require much higher levels of vitamin C because they use more. Smokers use vitamin C stores extremely fast, about 200 milligrams of vitamin C used per one cigarette smoked. It's been shown that in autopsy, when patients were evaluated in regards to their blood vessel wall, that they found microbial infections that could cause local inflammation, for example, periodontitis, which is, inflammation around your teeth, and root canals that are chronically infected. Those patients have higher levels of inflammation in the body, and then these infections cause this chronic inflammation. The chronic inflammation then causes a more accelerated arteriosclerosis and use of vitamin C. And then the lack of vitamin C can promote the inflammation to be literally going into all the arteries from that one pocket of dental problems. This kind of ends the part about the vitamin C in Dr. Levi's book. Heavy metals have been shown to be associated with arteriosclerosis, and the mechanism is that heavy metals increase the oxidative stress. They utilize the antioxidant system in the cell. Heavy metals increase inflammation. They interfere with calcium signaling. They cause endothelial cell dysfunction, which is the small lining of the blood vessel wall. So when this is the initial injury that occurs to start the arteriosclerotic process. Heavy metals increase blood pressure, they induce kidney problems, and they change epigenetics. And I've talked about that more extensively in 2 other videos on environmental health, and I want to refer you to those if you want more information about exposure and all of the diseases that are associated in research with heavy metal total body burden. It's It's been shown that low-level lead, which is just one of many heavy metals that we're exposed to on a daily basis, is a silent killer in the United States. And the increase of death from all causes increased by 25%. But for heart disease, cardiovascular mortality is increased by 55%. Heart attack death rates by 89%, stroke death rates by 151%, and that in this large study, 38% of the U.S. adult population is at risk because of the levels of lead exposure. There are many studies in regards to chelation. In Denmark, it was an interesting project in 1992 because the government with socialized medicine was spending a lot of money on coronary artery bypass grafts, so they tried chelation. And 65 people who were on the waiting list to get a bypass, only 7 required it after chelation therapy. And 27 who were scheduled for amputation because they had severe artery disease in the legs, only 3 needed the surgery. The study was done over 6 years, and the chelation treatment saved the Danish government about $3 million. In 1993, there was a meta-analysis done. A meta-analysis means that all of the studies that are done on a particular subject, if there are certain criteria that the study has, they're taken together and seen what is the overall outcome. So it involves a lot more patients. In this case, there were 40 studies, 19 met the criteria. That encompassed 22,000 patients. That's a lot. And this was to use EDTA chelation for cardiovascular disease. And what they found was that chelation therapy was helpful in patients with cardiovascular disease in 88% of the patients, and they showed improvement with objective testing. The TAC trial is what put chelation back on the map, despite much adversity from cardiologists. This was done and published in the Journal of the American Medical Association. This was chelation therapy for patients who had prior heart attacks, and it showed that EDTA reduced the events, cardiovascular events, by 18%. When just oral vitamins were given, the reduction was 11%. When you combined chelation with vitamins by mouth, the reduction in events was 26%. The reduction in cardiovascular events was 41%, which is very, very high, and 43% less mortality. Also, substantial reduction in heart attacks, reduced by 51%. Nitric oxide deficiency has been shown to be a causative agent in the progression of atherosclerosis. Heavy metals do inhibit nitric oxide production. The progression can be significant and rapid. As I said earlier, nitric oxide production decreases after the age 40 in humans. The relationship between vitamin K and peripheral artery disease has also been investigated in a very large study, 36,629 patients. They were given high-dose vitamin K, that peripheral artery disease, and the high intake in vitamin K was associated with a reduction in risk of peripheral artery disease, particularly in high blood pressure patients. Glutathione is part of the antioxidant system of detoxification. There's one study that showed supplementation with glutathione improved the dysfunction of the endothelial cell lining, and it did so by increasing the body's production of nitric oxide. There were investigated patients who had a gene defect to make glutathione in a certain enzyme, glutathione peroxidase. So it was part of the production of glutathione, and they showed that there was a significant thickening of the inner lining of the artery, meaning more arteriosclerosis in the carotid artery and in peripheral vascular disease. Then there was a study that shows that an imbalance of these antioxidants are very much part of the process of developing arteriosclerosis. What's important with the glutathione is there's many supplements out there. Only liposomal glutathione orally gets absorbed well, and we give it intravenously after chelation or other vitamin infusions. This is interesting work. Very few people know about this. Dr. Broda Barnes, he in 1976 wrote a book called Solve the Riddle of Heart Attacks, and he compared the results from the Framingham study, so that was 5,000 patients between 32 and 60, and they had a rate of heart disease of about 150 per thousand over 20 years. And he compared his cohort of 2,000 patients that he treated with desiccated thyroid hormone, which is equivalent today with Armour or Nature Thyroid, over 20 years, and the heart rate disease there was 2 per 1,000. And one of the potential mechanisms of this is that particularly things like Armour, desiccated thyroid hormone, they contain all 4 thyroid hormone. We produce T4. Out of that, we make the active form of T3. There's also T2, which appears to regulate the density, mitochondrial density in the cells. And so the idea is that when we're increasing mitochondrial density and we are able to produce higher energy, we can make the cells function better. And that could be one way of being able to prevent heart disease. And so it is important to evaluate thyroid hormone status in everybody, and where indicated and where needed, supplementing with bioidentical hormones. Those are the natural hormones like Nature, Armour, Thyroid. Synthetic hormones only give, for example, T4 if there is endocrine disruption in the body, for example, through heavy metals. Then oftentimes the effects are not as good, and too much reverse T3, which is an inactive form of thyroid hormone, is being made. Broda Barnes was the assistant professor of medicine at the University of Illinois and then department chair of physiology. He wrote some brilliant books on the subject matter. This is it for this update. I hope you enjoyed this information. It's definitely a different view of why and how arteriosclerosis is created, but also allows some new avenues on how to prevent it and possibly reverse it. If you would like more information, you can find us on our website, www.deficiencies.org. www.ammedicalmd.com. We are located in Yelm. Here's our phone number, and you can follow us on Facebook and YouTube. Thank you for watching.